Now, first story. Patients requiring lab tests as part of treatment have been left stranded at the Komfanochi Teaching Hospital. Medical laboratory scientists and allied professionals have today commenced a 7-day sit-down strike. They are protesting the decision of management of the hospital to send 2 doctors to work in the lab. They insist professional members of the association who qualify to fill the 2 available slots have been sidelined for the doctors, and they argue the doctors should not be working in the labs. Ohiming Teria has the rest of the story.
The over 300 members of the association comprise laboratory scientists, laboratory technicians and laboratory assistants. They argue professional members of the association who qualify for vacant positions have been sidelined. Members at an emergency meeting on Wednesday resolved to stay off duty.
The outcome from the membership of GAM's KATH chapter is very simple. From tomorrow, Thursday, the 20th of May, we are beginning a sit-down strike where we will come to work, but we will not work. So no patient sample, no sample from anywhere will be worked on in our labs in KATH from tomorrow, Thursday, 20th May, up to next week, Wednesday, 26th of May, 2021.
Local Union Chairman Ernest Bedu-Boatin tells Joy News the lab professionals are appalled by the stance taken by management of KATH.
The laboratory profession over the years have matured and have grown. And so there are professionals within the laboratory services and within our professional cadre who have been licensed by the Allied Profession Council and are being monitored and their practice controlled by the Allied Profession Council. Same way, these medical officers are also being licensed by the MDC, the Medical Data Council, and also have their own professional line of practice. There is no conflict between their line and our line. They are clinicians, we are laboratory. We practice laboratory science, they practice medicine. The two are different by law under Act 857. And so all we are saying is that they should be in their lane. They should practice their medicine and also leave us to practice our medical laboratory science as defined by law that was passed by Parliament in 2013. And so the presence of these people in our lab, what it means is that, what they are telling is that our consultants who are fellows of the West African College of Medical Laboratory Science, who hold their PhDs, who hold their masters, don't have that qualification, or they don't come near the job that these LPs are coming to do. And that we will not agree, because the two professions are different. And where they interrelate is where a doctor will request for a test to be done on a patient. Then the lab will come in and perform that diagnostic test, so the doctor will use the results to treat the patient. It is not the duty of the doctor to come to the lab, request a lab test, come to the lab, run the lab test himself or herself, and now use the result. That is not done. And that is what we are fighting against.
The action of the association is expected to affect diagnosis, investigations and treatment of patients at that teaching hospital. The hospital is also expected to lose revenue if the strike is protracted. But Mr. Bedu-Boatin says members have no option than to resort to the action.
We have laboratory scientists, we have laboratory technicians, we have laboratory assistants, all within our cadre. So all of us are working here, and all of us, we are the ones manning all the labs in KATH. We are the professionals who are running all the tests that patients, when patients come here, they go through before they are given drugs or they are treated. So the impact of this strike, I can tell you, is enormous. Besides that, we are the revenue generating, one of the highest revenue generating directories in Komfanochi. So that I can tell you that even a day, if a day without work, a day without LSD generating money, this hospital will suffer financially. And so the earlier they resolve this matter, the better for even the financial health of this hospital.
Meanwhile, management of KATH has declined commenting on the impasse. From Kumasi, for Joy News, Ohiming Teria reporting.
Ohiming joins us with more now. Ohiming, tell us about the impact of this strike. We understand some patients are stranded. Ohiming, tell us about the impact of the strike, if you can hear me.
Yes, sir. Thank you, Daniel. The patients are stranded at Komfanochi Teaching Hospital in their struggle to get the laboratory services here at KATH. I must say, a few minutes ago, I had a chit-chat conversation with two of them who had been asked by their respective medical doctors to get lab services here. But unfortunately, just at the polyclinic, Companoche Polyclinic, they have been told the medical scientists are on strike. So they have to go and then come back probably at a later date. But when I thought to find out from them what they will do, they tell me the only option available now is to consult, compare with the medical doctors and see if they are allowed to go out of the hospital premises to have these services before they can come back and then continue with the diagnosis process here at Companoche Teaching Hospital. So I must say, as it stands now, though it's early days yet, but the strike is taking a toll on patients who need laboratory services at the main Companoche Teaching Hospital and then the polyclinic. This is where we refer to as the family and medicine directory. So all these units at KATH are affected as far as the medical laboratory scientists strike is concerned, Daniel.
Now, Ohiming, we know that apart from the patients, the doctors will also feel the absence of these scientists, because when you go to a hospital and the doctor is diagnosing what is wrong with you, he needs the lab technician. Have any of the doctors spoken about how they are managing the situation in the absence of these scientists?
Unfortunately, I have not managed to have a word with the doctors because they are in the consulting room, and because we've been monitoring the effects on the patients, we are yet to speak to some of the medical doctors. But then I've had a word with the PR.
Right, Ohiming Terry there, coming in from Kumasi with an update. You just heard him mention that he has been speaking with the public relations officer of the hospital, and we will get a word from him on what has been said. Ohiming, welcome back. Tell us what the PRO for the hospital told you.
Unfortunately, I haven't had that particular interview with the PR unit yet, but what I've said is that I've asked them for an interview to speak to them on what the hospital makes of these striking medical scientists strike on the hospital. But I have with me here the president of the Ghana Association of Medical Laboratory Scientists here, Mr. Enders Pedu Boateng, who earlier told me they are concerned with the impact that the strike action has had on the patients. So, Daniel, if time will allow us, let's take a word from him.
Right. I mean, time will allow, I hope. Let me just put a quick question through. If you can hear me, sir, how do these patients now get diagnostic services, especially patients who come sick to the hospital, who need a laboratory tests to get a diagnostic service? How do they do that now?
Can you come again? I just got connected.
I was asking what happens to the patients. The patients need lab tests so they know what is wrong with them. How do they do that now?
All right, for now, they can't get any laboratory service from Companoche Hospital laboratory. But there are private laboratories around where they can probably seek those services from. But, you know, this is a teaching hospital. And so we offer more specialized laboratory services than our colleagues in the private sector. So they can seek the general laboratory services outside. When it comes to the specialized laboratory services that they can only get from Companoche, they cannot be able to seek those services at these labs dotted around Companoche and elsewhere. So that is the impact that our strike is having now on patient care and patient management in Companoche Hospital.
So what you're saying, sir, is that people who are most seriously sick, who need specialized laboratory services, would simply have to wait till you come back?
Yes, as it is now, we are not offering our services to patients. And so anybody needing any laboratory test within that specialties, either hematology, microbiology, histopathology, or biochemistry or chemical pathology, that patient will have to wait until the ministry and authorities in charge of conformity resolve this matter, and then we can resume work and serve our patients.
But have you heard from management quickly?
Of course, management called us to a meeting on Monday. We've also had other sideline meetings, but all of them did not resolve this matter, as in getting the two hematologists removed from the hematology lab. We couldn't resolve the matter, hence where we are today.
For joining us, that was the president of the Ghana Association of Medical Lab Scientists in the Komfanochi Teaching Hospital.